Acipigrel uses, dosage, and important precautions. Acipigrel is a prescription medication used to prevent blood clots from forming in the arteries, helping to reduce the risk of stroke, heart attack, and other cardiovascular problems. The drug works by inhibiting the action of platelets, the small cells in the blood that help form blood clots. Uses preventing blood clots. Acipigrel helps prevent blood clots from forming in the arteries, especially in people at high risk for cardiovascular disease, such as those who have had a stroke or heart attack, those with coronary artery disease, those who are using stents, etc. Uses reducing the risk of stroke. Acipigrel has been proven to reduce the risk of stroke in people at high risk. Reducing the risk of heart attack. Acipigrel helps reduce the risk of heart attack in people at high risk, especially after heart surgery. Dosage. The dosage of Acipigrel is prescribed by your doctor based on your individual health condition and other factors. Typically, the initial dosage is 5 mg per day, and it can be adjusted to 10 mg per day as needed. Important precautions when using Acipigrel. Take the medication as prescribed by your doctor. Do not change the dosage or stop taking the medication without consulting your doctor. Important precautions when using Acipigrel. Inform your doctor about any health issues. Tell your doctor about any medical conditions you have, especially liver and kidney problems, allergies to any medication, pregnancy, or breastfeeding. Important precautions when using Acipigrel. Use with caution when taking other medications. Acipigrel may interact with certain other medications, so inform your doctor about all the medications you are taking, including prescription drugs, over-the-counter drugs, and herbal supplements. Important precautions when using Acipigrel. Monitor for side effects. Acipigrel can cause some side effects like unusual bleeding, headache, dizziness, nausea, diarrhea, etc. If you experience any side effects, inform your doctor immediately. Important precautions when using Acipigrel. Avoid activities with a risk of bleeding. Acipigrel can increase the risk of bleeding, so avoid activities with a risk of bleeding, such as dangerous sports, using razors, etc. Important precautions when using Acipigrel. Get regular blood tests. Your doctor may ask you to get regular blood tests to monitor the effectiveness of the medication and ensure safety. Store the medication properly. Store Acipigrel at room temperature, away from sunlight and heat. Keep the medication out of reach of children. Platelet transfusion therapy. Platelet transfusion therapy can be used to counteract the effects of Acipigrel when needed, such as when a patient is bleeding. Note: the information above is for reference only and does not replace the advice of a medical professional. Always consult your doctor for advice and treatment.